Welcome to Senior Moments, the show where we talk about all things senior, the good, the bad, and the utterly ridiculous. Today I have with me Doug Hawkins. He is the administrator of Kit Carson Nursing and Rehab.
Yes.
Welcome to the show.
Thank you so much for having me.
Thank you. Why don't we start with how you ended up being administrator of Kit Carson?
Yeah, absolutely. So a little bit about me. I grew up in the industry. Literally, I was a 5-year-old running around the skilled nursing facility, helping in activities, helping my dad staple orientation packets together because it was kind of my daycare. My dad worked in healthcare and all that. So fast forward to, I'm a 6th-generation Amador resident.
Okay.
My children are 7th. So Kit Carson was a facility I ran around as a kid. So I, after my childhood, I worked through healthcare, working as a janitor, working in maintenance, and all that. So when the opportunity came available to become the administrator of Kit Carson, I just jumped at the opportunity and was thrilled to care for my community.
That is amazing.
Yeah.
I think there's something really valuable in knowing an operation from the floor up.
Mm-hmm.
So I think you have a unique perspective, and that ought to inform a lot of your decisions.
Yeah, absolutely. It helps in all day-to-day decisions and everything I do. I've held almost every position in a skilled nursing facility, and it allows good feedback from my staff and with every decision we make. So it's very pivotal.
Oh, absolutely. And you know exactly what they're going through.
Mm-hmm.
So if they bring up an issue, it isn't, oh, well, that's something I never thought about. You can relate a lot easier
Right.
because you've probably had something similar happen in the past.
Yep, gone through those challenges myself.
Sure.
Absolutely.
So what kind of challenge, everybody when they come in, at least this is my opinion, to a place as administrator, has certain goals and that they want to, goals and policies that they want to implement when they become administrator. So what are some of the things that you decided would be beneficial for Kit Carson?
Yeah, so when I started at Kit Carson, I can tell very often from the get-go that the staff care. There's a lot of longevity of care. There's some staff who have been there 30 years. So really my big focus was just making sure there's structure, all systems are in place, and the biggest thing is just education. Because education never ends. You're always going to be learning. But the biggest thing I've learned is you can't teach care. So if you come in and there's care, you're off to the races.
Absolutely, and technology keeps getting better and better, so.
Mm-hmm. Absolutely, and we've been harnessing that since I've started at Kit Carson too.
Okay. Mm-hmm. So what would you say is maybe one of the big changes that you've made, or what you're most proud of?
Yeah, so I would say my one big focus has just been the team, redeveloping the team, because that's where I focus most on, right? My team is kind of an extension of me. So since I started, we have a new director of nursing who has extensive background and actually kind of goes beyond skilled nursing. She did a lot of subacute care, that sort of thing. So very versed in high acuity care.
Oh, that is wonderful.
Mm-hmm.
Yeah.
Yeah.
So how do I end up in a skilled nursing situation? What would prompt me to end up being at Kit Carson?
Yeah, so obviously a few ways, but a lot of what we see is when individuals say fall and have a fracture or elect to get a surgery, they'll go to a local hospital, whether it's at our Amador or Mark Twain, and then be seen for that. And after their stay there at the acute, they would come to us, and we're essentially what's called not just skilled nursing, but post-acute care, because we're after acute. And then with us, through our interdisciplinary team, we come up with a plan of care, how to get individuals back to their prior level of function, whether that be through physical therapy, occupational therapy, or speech therapy. And often people come with IVs, we can handle IVs, things like that. And we just want to make sure as best as we can, we get them independent again and back to their prior level of function.
And who pays for this?
So that can vary as well. Every individual is going to carry different insurances. Mm-hmm. So if you have Medicare, that can often even be confusing in and of itself, because there are co-pays after a certain amount of days, that sort of thing. But depending on the individual's insurance, often the insurance pays up to a certain amount of days, and each insurance is a little bit different.
What happens if I run out of days with my insurance company?
So a few things. one of which is if we're driving the discharge, so to say, right? If we're saying individual has kind of plateaued their care, the individual can appeal with the insurance, and if the appeal goes through, then more skilled coverage can happen and more therapy can happen.
Okay.
Yeah.
And this is where I get confused with skilled nursing is I believe that you have a certain population that is post-surgery, let's say, and they're there for rehab, everything goes great, they're able to walk out the door in 30 days, let's say. But then there's a person that comes in after surgery for rehab, and the rehab part goes all right, like let's say they can walk again, but their mental acuity just never comes back. Let's say we saw a marked decline after the surgery and it just never comes back. What happens to those people?
Oh, excellent question. And it kind of ties to your last question, what happens when the insurance runs out, that sort of thing. So we see that dynamic a lot, right? Where I think often the ultimate goal is to get back home and that sort of thing, but that can often change and not be the case. And so what can happen is that can transition to long-term care with us, which we do have as well. We not only do short-term care, we do long-term care. And so we're still part of that journey, whether or not it's getting back home or us becoming the home.
Okay.
Yeah.
And how do people pay for the long-term care? That's a sticky wicket.
Yeah, absolutely. So if the individual does not have long-term insurance, say Medi-Cal, in all of America it's really called Medicaid, but in California it's called Medi-Cal, we would help that individual apply for Medi-Cal, and Medi-Cal would pay for room and board and everything else that comes with our services.
Okay. Now I have heard in the past that, let's say I have between my Social Security and I have a retirement coming in, maybe I've got $3,000 a month, that the skilled nursing would take all of the $3,000 but give me $35 back, and then I guess the government makes up the difference at that point.
Yeah, and this often becomes a surprise to individuals that come to us, and essentially it's Medi-Cal derivative. So more or less a very broad way to explain it is yes, if you are on Medi-Cal and you have income, that income gets absorbed into what's called a share of cost, and then that individual is left with $35 discretionary, what they can use for the month, that sort of thing.
Okay.
Yeah.
What kind of, this is kind of, I don't even know if it makes any sense, but do you have activities for your patients that are there, they're going through their rehab, but they're still pretty, they got a lot of energy and they need to be doing something? How do you keep them occupied?
Yeah. So certainly, and every day we're just kind of trying to think of new things, and we ask short stay and long stay residents what activities they would like. So one thing we did actually last week was, and people got a hit out of it, was karaoke.
Okay.
And so we want to start kind of doing things like that, more karaoke, where you just get everyone in the facility involved and that sort of thing. We also have different vendors come out who play instruments and things like that. And we've done in the past, what do you call it, petting zoos
Oh,
and things
wonderful.
like that.
Yeah.
Yes. So just always trying to keep something new and fresh.
Sure.
Yeah.
And then there's a dog group that comes through, isn't
Yes.
there? They're
Yes.
still coming through. Yeah, those guys are great. Those dogs, I tell you, they're
Oh yeah.
Just,
And they get a kick out of it.
an immediate mood. The mood just absolutely rises.
Oh yeah.
Yeah.
Absolutely.
That is great. Yeah, I saw a thing on Facebook that I just think was hysterical. They had a big long sheet of paper in front of each person. Each person had their little hobby horse, right? And then they'd say go. And they'd go like this to whoever got that sheet of
The
paper
paper
all the way
through.
under the chair first. What a lovely activity that most everybody could do as long as you could move your legs. You don't have to be standing up. You don't have to have good balance. And this is really good exercise, actually. It does get your heart pumping.
Oh, absolutely.
So, it's just incredible to me, some of the things that people are coming up with, too.
Out of the box ideas. One thing we've done a few times is you get laundry baskets and you tie a pole to it and you do the hungry hippos and you get the balls in the middle, and the more balls you can get, and people have a hoot out of that too.
Oh, that is funny.
Yeah.
That is great. And then what about spiritual needs?
Yeah, so we also cater to that. Whatever the individual's spiritual needs are, we can do that. So example is Catholic services around at the facility and other services as well.
There are, and again, there was a group that used to go around and do kind of a non-denominational service. Are they still doing that?
Yeah,
as
absolutely.
well? Okay. Do you have any kind of a chaplain or that's kind of there all the time, or?
We do have some routine ones that come through. Yes.
And then I know with assisted living, they will coordinate with hospice. Is that something that skilled nursing does as well, or are you basically hospice?
No, absolutely. So we do hospice and palliative care and comfort care, all depending on what the families and what the residents want. So we do offer those services as well. And sometimes, once again, you see that in transitioning from the hospital, plans can often change very rapidly. And so we want to make sure that we honor those requests as far as hospice goes and those sort of things, yeah.
So is the hospice service contained in-house, or do you use an outside agency? I know there's several in the area.
Yeah, outside agencies that we work with, yeah. And they come in, they work with our staff. And it's nice because not just for the resident, but the families, it's really an extension beyond us. You know, there's additional staff, there's chaplain services, spiritual services, grievance services. So I'm a big advocate for hospice.
Oh, that's wonderful. I'm glad to hear that.
Yeah, absolutely.
Yeah. So what are we not talking about that we should be talking about?
Oh, excellent question. I don't know.
Let's talk about maintenance, because I'm going to tell you, when I was a kid, I went into a nursing home with one of my friend's moms to go see their grandma, and that smell about knocked me over. But when I go to Kit Carson, I don't smell that. So how are you able to manage that aspect of the business?
So just like your household, it takes a lot of consistent cleaning. The staff are frequently rounding. They themselves think outside of the box of, what else can we do and step up, and what deep cleaning programs can we put in place? Because it's not just, cleaning a room once every day. You have to take everything out of rooms and deep clean them, things like that. So, and going back to, it's nice that I have a background in that, being a janitor and housekeeper and all that, and sometimes I like to jump in and help turn some beds and do that.
Sure.
Yeah.
And then what about that? It always used to be the cherry Jello stains that people. They always had an issue with cherry Jello stains. Is that something that's a thing of the past now?
Oh, I think so, yes.
Oh, good. I'm glad to hear that.
And then the food often, there's a disdain in the industry often because, hospital food, skilled nursing food. I eat the food every day just so I can make sure, and I try varying meals and all that just so I can make sure I'm eating what our residents eat. And, is it hot? Is it good on the palate? Does it taste good? Is it presentable? So I just try to put myself in those situations so that I myself can, one, speak to it, but two, if changes do need to be made, I can also speak on behalf of that.
Absolutely. Yeah. And then do you have the ability, if I have dietary restrictions, let's say I'm a observant Jew and I have certain dietary restrictions, can you work around that and still satisfy the state? I know there's state requirements.
Yeah, certainly. So we work with that. What happens is our staff are well trained in our dietary and our nursing departments. It all gets charted in our electronic medical record, and then each meal there are printed meal tickets that have those diet restrictions, if there's any allergies, if there's likes and dislikes. That way, when they're preparing the meal, they can know, okay, no, they don't like salad, or they're lactose intolerant, and they can honor those restrictions.
Oh, that is wonderful. And what happens when I'm ready to go home? What kind of a team do you have that's going to help me transition from skilled nursing to my home?
Yeah, absolutely. So my nursing department, in conjunction with Rehab and my social services department, they all collectively work with someone discharging, and that can vary per individual. Sometimes home health is needed, so we can get home health set up. Durable medical equipment, if a hospital bed needs to be ordered, or a walker, that sort of thing. Those are all things we coordinate before discharge, if there's oxygen needed and all that. That way it's a safe discharge upon getting home and all that.
Oh, that is amazing. That's really good to know.
And then we do follow-ups too with those we discharge. So we follow up after to make sure they're comfortable. That because what we can do is within 30 days of discharge, often we can readmit. That way, if someone is, let's say it didn't go as planned and they're continuing to deteriorate or what have you, we can readmit them to our facility, and that way they don't have to go back to the hospital and go through all that. And so that we want to make sure we can take a look at that.
Oh, that's amazing. What happens if it's after 30 days? Let's say it's 31 days.
Yeah, and so problem is that's all once again derivative of the insurance.
Sure.
So depending on the individual's insurance, there has been cases where beyond the 30 days we are able to still readmit them, bypass the hospital. So we look closely at that and try to coordinate that, because it is, you know, going to the hospital and coming to us, it can be quite the rigmarole, and if we can bypass that, we certainly would like to.
Oh, absolutely, and it keeps everybody's share of costs down then if you don't have one more step to go through before you
Right.
ultimately go back to where you needed to be in the first place.
Yeah, it skips a whole step and gets us closer to the end.
Yeah. So generally then, a hospital would recommend that I go to skilled nursing. And-
Quite often.
Okay. And then your doctors, your in-house doctors, are the ones that determine when I'm ready to leave, or are you still coordinating with the original doctor that maybe did the surgery?
Oh, right. Yeah, so that would defer to our doctors in-house. With that said, I mean, it's an excellent point. Sometimes we do talk to the discharging, not the discharging, but say if there's a surgeon, they do monitor if, you know, say they did surgery, that sort of thing. So the doctors would kind of work in tandem in that regard, but our doctor obviously gives, our doctor gives the discharge order, if it were.
Oh, okay.
Yeah,
Well, that makes sense.
yeah.
All right. So are most of your residents from Amador County then, or are you getting a little bit from Calaveras as well?
A little bit from Calaveras, yeah, predominantly Amador County.
Okay. How many beds do you have?
We're licensed for 199.
That is amazing. And are you typically at that 199 threshold and have to turn people away occasionally, or do you usually have enough room to bring people in as they need to come?
Yeah, we haven't had a challenge, and we haven't had to deny anyone due to space or anything like that, thankfully.
Oh, thank goodness.
Yeah. So our goal at Kit Carson is, because, you know, we're the only skilled nursing facility in Amador, and Sutter Amador Hospital is the only hospital in Amador. Our goal is to keep all of our residents in our community and care for our community.
That just makes it so much easier for your loved ones to come and see you and coordinate things, and
Oh, absolutely.
you know.
And quite often challenge isn't the right word, but our community residents get sent out to, you know, Sutter SACs and the dignities and all that, because their acuity is a little bit higher than our local hospital. So we track that. We work with the other hospitals in Sacramento and even sometimes Roseville, and to bring our community members back, because that's a long commute to go see your loved one in Roseville every single day, you know, when they're maybe at a skilled nursing facility for 30, 60 days getting rehab.
Exactly. And it's so important. I think having social interaction with your family and friends in a rehab situation is really important, because I think, it's my own opinion, it helps the healing process.
Oh, it does.
support.
It's a huge part of it.
So is Kit Carson is it publicly owned or privately owned?
Privately owned.
Privately owned? And is that a single corporation, Kit Carson, or are you part of a larger conglomerate?
It's a single corporation.
Okay. And do we have local owners?
They are not local.
Okay.
Yeah.
No, that's all right.
Yeah. But with that said, once again, that's where they really loved my vision and my story, is because it is grassroots. I'm from this community. I grew up in this facility, and so they really loved that. And my family has been at Kit Carson. I'll have more family at Kit Carson. So they really just love that and wanted there to be local leadership.
I think that's really important, especially in a rural county.
Oh, absolutely.
All right. Well, is there anything I haven't asked you today that I should ask you?
No, not that I can think of.
All right. I do want to say thank you for wearing a pink shirt. It is Breast Cancer Awareness Month, and I did not wear pink today, which I need to rectify that.
I covered us for today.
Thank you.
Of course.
Well, thank you for coming today. I really appreciated talking to you. Thank you to all our listeners. I hope you enjoyed the conversation as much as I did, and please join us again next time.